what happens when you get tested and it turns out that your test comes back positive? Well, I mean, that's really obviously good news. It means that we identified a potential medicine. For example, if you had in this case, an EGFR mutation, that we could pull one of the molecular therapies that we have off the shelf and use. But the crazy thing is, what happens if your tests aren't positive? Well, 30 years ago, 20 years ago, that might have been an issue. But the nice thing is we're in the 21st century. And in addition to molecular targeted therapies, we now know we have immunotherapies and many other therapies. And in fact, the chemotherapies that we use now are not your grandmother's chemotherapies. They're much more effective and they come with less toxicity. So when people say to me, oh, I don't know if I get tested and it turns out negative, I don't know if I want to know that. And if it's positive, I've hit the lotto. That conversation and language needs to give way to just get tested. If it's positive, great. We have ways and things that we can pull off the shelf from a molecular sort of therapeutic perspective and give to you. But if you're not, so what? We still have things, many more things that we have now than when I started in my career. Again, when I started, it was the age of one drug. It was a chemotherapy drug that was almost like really winning the lotto if it worked, because we would have to tell you honestly, we're going to give you this drug. I don't know that it will work. Most of the time it doesn't, but we hope you get lucky. We've now gone from that to saying, listen, we have biomarker tests that if it's positive, we can actually come with something precise for that mutation. But if it's negative, we still have therapies. This is an amazing time to sort of exist for medicine. Many of the drugs that are coming out of the FDA, most of them are cancer drugs. We've just started and we have so much more to go. So having a negative test these days means you just have a negative test. It doesn't mean that you'll get negative care or there aren't other therapies for you.